Okay, we can get started. Welcome, everyone. This is the CESLC Insider, Finding Inclusive Communities. Good afternoon, and thank you for joining us today for CESLC's Insider. I am your host, Jennifer Bunting, the Director of Admissions for Hebrew Home of Greater Washington. At Charles E. Smith Life Communities, we deliver quality care and meaningful experiences personally tailored to those who we serve, no matter where they are in life's journey. Our full suite of care and services available on campus include independent living, assisted living, memory care, post-acute care, long-term care, and primary care with the focus of older adults at our Hirsch Health Center. To explore our campus and all that our campus offers, please go onto our website at www.smithlifecommunities.org or call 301-228-0641 to schedule a tour. And you should see that information in the chat. I would like to thank Optum, our sponsor, for CESLC Insider. We truly appreciate your partnership. This program qualifies for one Category 1 continuing education unit for social workers. If you are a social worker and would like a certificate after attending this program, please email Rachel Fernew. You will see her email in the chat. Please give us 7 to 10 days to email you your certificate. We appreciate your patience. We will be recording today's webinar. The recorded version will be uploaded to a YouTube channel, as well as our website under the resource tab. There you will find the past programs and so much more. Don't forget to add your questions to the chat. We want to hear from you. Are you interested in living in an inclusive community, a space where everyone is respected and cared for? Have you ever wondered what signs to look for or how to tell a community might be right for you or your family member? Joining us today to help us recognize what to look for in an inclusive community are our guests, Sadiya Abjani, the Director of Training and Instructional Design with SAGE, and Brenda Rice, Vice President of Operations at Charles E. Smith Life Communities. Our guests will discuss best practices that the communities have put in place to create inclusive environments and create provisions for the LGBTQ and older adults. How to spot a community that is genuine about their equity journey, and what requests you can make to create an inclusive and welcoming environment for yourself or your family member. Ladies, please tell our audience a little bit about yourselves and the organization that you represent. Sadiya?
I'm going first. Okay, cool. Hi, everyone. My name is Sadiya Abjani. I use she, her pronouns. And I've been at SAGE for December will be 7 years. I've stayed in nonprofits my entire career, have my undergrad from UT Austin, Hook 'em Horns. And my role at SAGE is focused on adult education around LGBT elders. So we train people across the continuum of care. I'll talk a little bit about SAGE and SAGECare when the presentation starts, but I'm also a huge nerd, and I'm very excited to be here today with you. So that's a little bit about me.
Thank you, Sadiya. Sadiya, how about you, Brenda?
Good. I guess now we can say good afternoon. Thank you all for joining us. My name is Brenda Rice. I am the Vice President of Operations at Charles E. Smith Life Communities. We have about 1,100 lives across our campus, from our nursing home, which is 556 beds per license, which is, just so you know, the largest nursing home in the state of Maryland, and also the largest fully kosher facility from Miami to New York. So That is one of our big outstanding things. We also have assisted living on our campus. We also have 250 apartment independent livings on our campus. I'm a licensed nursing home administrator. I've been in Montgomery County, Maryland, as an administrator for over 20 years in this profession. So very happy to be joining you today. Thank you.
Okay, so SAGE is the country's oldest and largest nonprofit focused on advocating and providing needs of the LGBTQ and older adults. In this session, you will learn about the best practice communities have put in place to create inclusive environments and care provisions for the LGBTQ and older adults. How to spot a community that is genuine about their equity journey, and what requests you can make to create an inclusive and welcoming environment for yourself. CESLC earns the platinum level certification. But today we're going to start with Sadiya.
Wonderful. Thanks for the introduction, Jenny. Could we get that PowerPoint up?
Yes.
Awesome. So super short PowerPoint presentation, mostly for me, just so I can make sure I hit all of the topics that I want to, but we're going to talk a little bit about SAGE, a little bit about the population that we're discussing, and we'll jump into what are those specific pieces or markers of an inclusive community that you're looking for when you're going out and looking for a space to a residential living community. Great. So a little bit about SAGE. As Jenny was saying, SAGE is the country's largest and oldest organization focused exclusively on LGBT elders. We've been around since the 70s, mostly focused in New York at that time. But in the past 30 years or so, we've grown into a national organization that does pretty much everything you can think of when it comes to LGBT elders. So for our kind of local services in New York, we do case management, we have housing in New York, provide tenant services. We have senior centers all throughout New York. I think there's 5 of them. And then we have friendly visitors programs. I mean, there's so much happening in New York. Outside of New York, we have a ton of national projects. So our friendly visitors program has moved on to Miami and is going to be hitting a few other key areas where there's a high concentration of LGBT elders. We have veterans programs, we have advocacy on the Hill and off the Hill, housing advocacy that's happening. But and we also have 30 affiliates in 29 states, including Puerto Rico. But one of the projects we work on, the project I work on, is SAGECare, which is a cultural competency training and credentialing program. We train and credential elder care providers on how to work with LGBT older adults. I was just looking at the dashboard yesterday, and we've trained 163,000 individuals. I actually just hit my 10,000 people trained mark last month. And we have over 700 credentialed organizations in 49 states. North Dakota is still eluding us, and I'm really angry about it. So if any of you know anybody in North Dakota, please, we'll train them for free. We just want to say 50 states. It's so close. Next slide, please. Oh, cool. Well, that's it. We're done. All right. Talked a little bit about who SAGE is. Now we're going to talk about who we serve. Next slide, please. Great. So this is an image. We participate in every Pride Parade. We get a huge bus, and we do it all up really nice for Pride. Next slide, please. So all of you can use the raise your hand button. How many of you know someone who is LGBT? Click the raise your hand button if you know someone who's LGBT. All right, most people, awesome. And for those of you who don't have your hand up, you know me now, so everybody should raise their hand. Yeah, there we go. Now go ahead and lower those hands. Right. And the next question is, how many of you know an older adult? I'm talking 65 plus. That's LGBT. All right, a decent amount of hands, but definitely not as many as the first question. Why do you think that is? Why do you think more people raise their hand on the first question and not as many on the second? You can type in your answers in the chat box. Why do you think more people raise their hand on the first question than on the second question? Diana said they have not outwardly shared that though. Okay. I think there's more acceptance these days than in past years. Absolutely. We know, I mean, just taking a look at history, we know that being LGBT, open and out about it was not the safest thing. Stigma, absolutely. What else? Any other thoughts on why? Yeah, they're slowly but surely still coming out. That's absolutely true, right? LGBT older adults, especially kind of this age range, tend to come out much later in life. So it may be after a major life event, as it is for many trans folks. It may be after a death in the family, a divorce, things like that. But LGBT elders tend to come out much later in life after they face, you know, a history of not being accepted. Location, geography has a lot to do with it, right? Do they feel safe? Do they feel comfortable where they are? Are they in a place like New York City? Are they in a place like North Dakota, right? Our elusive white whale. Fear of reactions, may not believe organizations serving older adults are not welcoming, may not know how to be welcoming. Absolutely, right? If an individual does not feel, after experiencing this history of discrimination, if an individual does not feel safe, does not feel comfortable, they're not going to be out. And those of you who have been to any of my trainings before, you know that there's a significant amount of healthcare disparities. You know that there are issues with not knowing this piece of your client's identity. So how do we create those safe spaces, right? And if you are an LGBT elder, what are the things that you are looking for? So can you go ahead and hit the space bar or hit the next slide a couple of times? I think there's two questions that are going to pop up on this, and then it should be the next slide. Right. So many of you, or many folks who are doing, you know, or many folks who are working in direct care may think that they don't know an LGBT elder, but you're probably already working with LGBT older adults, and they may not feel comfortable being out about their identity. Go ahead and click the next slide. Keep going. All right. And statistically, we know that they're there. We know that LGBT elders exist and that you're probably already working with them. Click. In 2014, it was estimated that there are about 3 million LGBT older adults in the United States, or lesbian and gay older adults in the United States. And to put that into perspective for you, that's more than the population of Chicago. Keep going. All right, so 2014 estimated 3 million. In 2030, that number is set to rise to 7 million. Why do you think that is? Why do you think that number is going to jump? 15 years, it's going to jump. What? Math. I can't math. 4 million. There we go. Rise in aging population, absolutely. The boomers are aging into aging services. Baby boomers, yep. What else? The last 20 to 30 years has seen an increase in the acceptance of, or the rights and privileges available to LGBT elders. So you have more folks aging into aging services that are expecting inclusive care, right? This is their identity. They are proud of it. There's no reason to hide it. There's no reason to be afraid of it. they're going to expect a certain level of care. They're going to expect places and spaces to be inclusive, right? So how do we meet that need as well? Next slide. And I know that you are mostly Maryland, DC, or Nova based, but LGBT older adults, like there's this mindset that they're only in major cities, right? We exist in places like New York and San Francisco and LA, and that's about it. But the AARP released a study in 2018 that found that 28% of LGBT elders live in rural areas, right? And this is where they grew up, this is where they feel comfortable, but it's also that because of a history of employment discrimination, because of a history of economic struggle, many LGBT elders are being priced out of major cities. So if you live in a rural area, you're more likely actually to work with LGBT older adults. Next slide. So now to get to the meat of the presentation and introduce the lovely and wonderful Brenda, how do you know? How do you know what you're looking for? What are you looking for when you're looking for an inclusive space? How do you know that this is a space that's going to take care of you?
Thank you, Sadiya, and great presentation, and I'm so happy to be presenting with you. So as part of the LGBT family, for me, as a nursing home administrator, I always wanted to make sure that my residents felt safe. And just to give you a little bit of a backstory, my first nursing home that I was the administrator, I'm the administrator, and I walked in to find a transsexual, fully trans resident. And the staff didn't know what to do with this person. They didn't know what to do. So being able to work with SAGE and have this program available, now for our associates to be able to be educated. So looking at a facility that has gone through SAGE, and I'm really proud of our organization, and as large as we are, when I said we have 1,100 lives across the campus, we have over 800 associates who have been trained in SAGE and the SAGE training. And it was really important for me to make sure that our residents being taken care of. No matter if you look like me, if you look like Sadiya, if you look like Angelique, it doesn't really matter, but are we able to take care of you? So through the training with SAGE and making the availability of having a safe space for our associates, because even you may not be gay, but you know someone who is gay. And if someone's sitting with you at a lunch and they're making comments and being homophobic, and you're sitting there and it's like, well, my sister's gay or my brother is gay, or trans. We really found that a lot of our associates really felt safe because of our SAGE training to be able to come out and say, it's not okay to say that. And being able to come, and then allowing our residents to feel safe. So when you're looking for facilities, have they gone through SAGE training? I do find it's an incredible program, and I'm really happy that we're here today.
Are you listening, North Dakota? Also, I totally did not pay Brenda to say all of that. Just want everyone to know everything is above board. We are just that awesome. Thank you.
I don't even know anybody in North Dakota, or I would help you.
Please, I'm begging. It's been 2 years of this. So what I'd like to do now is on the next slide, I just have a rough sketch of some of the things we look for when we're looking for inclusive spaces, some of the things that we kind of control for when we're providing credentials. And I'd love it if I could talk a little bit about each of these buckets and then hear from you, Brenda, about what Charles E. Smith is doing, what you've seen in the field, what kind of experiences you've had in the field with these pieces. Does that sound good?
Yes.
Great. So when you are looking for a residential community, when you're looking for a space of care, I know that one of the first things that most folks do is either talk to a social worker that they're already speaking with about whether this place is going to be inclusive, or go to the website. Right. So when I am looking at whether this is going to be an inclusive service of some kind, I go to the website, and the very first thing I look for is a non-discrimination statement, and not just the standard language of, this facility does not discriminate on basis of race, sex, creed, just the standard language that's in pretty much every statement. I'm looking specifically for, does it say sexual orientation, gender identity, gender expression? And the reason why I'm looking for that specifically is because the federal government does not have any laws around housing or employment that specifically prohibit discrimination against LGBT elders. Now, there are court cases going up to the Supreme Court right now that say that the Fair Housing and Employment Protection for sex as a protected class, that includes gender identity. But with our Supreme Court, the way that it is, I don't think that's going to go through. So what we are looking for, and what we have been looking for, is, has this facility, has this community considered that LGBT folks exist? And if they've considered it, where is the language that specifically shows that we are included or that we will be safe there? Because the federal government has no specific rules. And the distinction is so vast. So take the state of Pennsylvania, right? In the city of Philadelphia, there are city county-based protections. So if I had a female partner, if me and my female partner went to a rental company and tried to look at an apartment, they can say, oh, we don't rent to lesbians here, or we don't want gay people here. And that's perfectly legal. Right, or sorry, that's illegal in the city of Philadelphia. But if we went to, let's say, Lancaster, Pennsylvania, I'm getting so confused. Pennsylvania state does not have any protection. So in Lancaster, they can say, oh, we don't rent to lesbians, and it's perfectly fine. If we went to Philadelphia, Philadelphia has those city protections, and we would be protected. So the protections are so patchwork that having it there specifically saves people a lot of headache around whether they're going to be protected or not. We also see a lot of companies having a renewed commitment to diversity and equity work. And so if there is a page on your website, if there is some kind of vision statement or mission statement that includes diversity and equity, race is going to be a component of that. And often sexual orientation and gender identity are also a component of that early DEI journey. So any mention of diversity and equity means if the organization isn't specifically working on sexual orientation, gender identity, they're at least thinking about how to be more open. They're having those critical discussions about what it means to be an inclusive community. Brenda, your thoughts on that?
Yeah, I think when you're looking for a community, and especially with a spouse, does that community meet across all levels of care? Because you may be at one level and your spouse may be at another level. Just to give you an example, if you both move into independent living, is that next level, are you going to be able to make those decisions in a facility? So one is in independent living, and your spouse may need to move over to assisted living or into the nursing home. Are you going to be represented? Are you going to be allowed to make healthcare decisions? And are they going to respect those decisions that you're going to want to make? So really kind of looking at all levels because you may go in at independent, both of you may go in at independent living, but as we age, you may need a different level of care for each of you.
Okay, great. Forms. So one of the first things that folks fill out, right? You see the non-discrimination statement, you look at the website, and then you go into the community and you're asked to fill out forms, right? We suggest that one of the things we look for is when you're asking about, or first, does the facility ask about sexual orientation and gender identity, right? When I'm filling out the form, does it say sex, male, female? Does it say marriage status, single, married, widowed, right? Is are the forms set in this assumption of heterosexuality and heteronormativity, or are they open, right? And that openness, because of the type of world we live in, that openness should not be on admissions forms, right? If an individual is filling out paperwork that will determine whether they are allowed to live in a particular place or allowed to access particular services, the assumption is going to be that I'm being asked about my sexual orientation and gender identity to be discriminated against, right? Because that's legal in many places. So what we suggest is that instead of asking those questions on your admissions forms, they should be asked on intake. So SAGE takes a look in our policy reviews and paperwork reviews. We take a look at intake forms, right? Do the intake forms include a larger understanding, let's say, of sexual orientation and gender identity, right? When they ask about people that are important to this individual, when they ask about marriage status or things like that, does it include, domestic partnerships? Because even though we have marriage equality, a lot of our LGBT older adults don't get married because they may lose access to certain disability services. They may lose access to some monetary compensation. They may also just not want to participate in a form of connection or marriage or a legal institution that never really cared for them in the first place in their eyes, right? So there are many reasons why LGBT older adults don't get married, but a lot of them do not. So does it include an understanding of those types of relationships? And also, is there a way to integrate ideas about families of choice? So if you're an LGBT older adult, or if you're an older adult that's going through the admissions process, are you asked about people that are important to you, right? How are you asked about these questions? Do you just get asked, tell me about your spouse, tell me about your children? Or do you get asked, tell me about the important people in your life? If you have a good day or a bad day, who do you pick up the phone and call? Do you want that person involved in your care? And does the facility have ways of creating that documentation, right? Is there a lawyer or paralegal or someone that I can talk to that will help me draft up a living will, that'll help me draft up legal paperwork that will make sure that who I want taking care of me is allowed to take care of me? Because think about it, for a lot of LGBT elders, their next of kin may not be the person that they want making decisions over them, right? LGBT elders, LGBT folks in general, rely heavily on families of choice. For me, if God forbid something happened to me, it's not my mom and dad that get to make decisions. It's my best friend who lives right next door, right? Because she's my family here. So what's the process around all of that? There are, what do the visitors policies look like? What do those get to know you forms look like? The preferences in everyday living, that PELI, does it ask about sexual orientation, gender identity? Does it ask if you're a member of the LGBT community? Does it ask about those things, those parts of your identity that you love and you want to share with other people? What is what are the forms and legal things in place that acknowledge our various different identities? Brenda?
Yeah, you bring up a lot of great points. I think anytime you're looking for a facility, going in and touring the facility, not only, talking to folks on the phone, and a lot of times people choose a facility based on location. And Katie, I think you put in about the 55 plus active communities, and a lot of, living in the Washington, D.C. area, there are a lot of CCRCs in this area. But once you start to get away from this area, it's a little bit more rural areas. And it's like, how comfortable are you when you walk in? And don't always let them know you're walking in, and ask to take tours and talk with the associates, because how are they interacting with you? I'm, as a female, when I walk, I'm 6 foot tall. I know you can't tell my sitting, but when I walk in, I usually get noticed just because of my height, and I have a lot of freckles, which you can't tell either. So being able to walk in, and there's some identifiers. I have short hair. My spouse, who I'm happy to say next week we will be together 30 years. which is crazy because I'm not that old. We got together when I was 5. But, you know, when we walk in together and we have our 3 kids with us, there's a lot of things that are going on. And I think you're absolutely right. Who gets to make your decisions? You know, how are they going to interact with your family? Those kind of things, and looking at it as, how is my family going to be? How are you going to take care of my family along with me?
So, Sadiya and Brenda, we had a couple of people of remark, and I think there was an acronym that you used, Sadiya, that someone wasn't familiar with. And so thank you. We had someone from the group give an explanation, but I wanted to make sure that everyone was aware. But so DEI.
Sure. So DEI, DIE, however, D and I, it's written a bunch of different ways by a bunch of different companies, but it's diversity, equity, and inclusion. Some folks will say that it's a fad hitting all of these larger companies. I think it is, you know, a long time coming, but diversity, equity, and inclusion, if you see a website or a web page on the site dedicated to that, if you see a DEI plan, those are indicators that organizations, companies are seriously thinking about their commitment to diverse communities. You know, oftentimes, and this may be a little controversial, but honestly, if we sit down and think about it, oftentimes when we're thinking about narratives, work, how we kind of go about our day-to-day, it's often geared towards a particular type of person. And it's mostly a white middle-class individual who is heterosexual, has 2.5 kids, a dog, a cat, a picket fence, white picket fence, right? This is the narrative that we're working towards. And I mean, even in our LGBT work, right, often the stories that get told are that of white gay men, right? So diversity and equity and inclusion work within an organization is a way for an organization to say, we're going to step back and make sure that the stories that we're telling, the people that we're caring for, the way that we're going about our work is as open and inclusive as possible. So it's not the dominant narrative that's constantly being worked towards. It's a larger narrative that includes more of the population. All right, so the next thing I look for is programming. So what kind of LGBT specific or LGBT kind of inclusive programming do we have? Is it just during Pride Month? Or is it happening kind of consistently throughout the year? Is there something that I can point to, a meeting group, a movie night, a book club, something that I can point to that I see happening across the calendars, right? Also, do they have a good balance of inclusive and population specific groups? So what I mean is, you know, so for instance, if you have an LGBT movie night, that doesn't mean that just LGBT people are invited, right? It's a movie night that hits on different LGBT issues or is directed by an LGBT person or has a topic that is close to LGBT individuals, right? So, right, that's inclusive programming. It's open to everybody, but it's on that specific LGBT topic. And then there's population specific. So do you have like an LGBT kind of support group that meets? Do you have an HIV/AIDS support group that meets? Do you have places for individuals who have experienced a very specific history, a specific narrative, a specific trauma, for them to meet and talk to one another, right? So I'm looking for a good blend of all of those. Brenda, do you want to talk a little bit about programming?
Sure. So I'm actually going to put, Gary, you asked a question and I'm going to change my background here. And the reason I'm going to change my background is because this is actually on our website. And it flashes, it's on all of our emails. So when you're asking about the representation and how does someone know, how would someone know walking in? So really happy to say, like back in June, which, you know, we all know is Pride Month, our life and leisure staff across our whole entire community, because we had just gone through all this SAGE training. And I will tell you, our president CEO said to me, he's like, we're not going to see any, you know, pride activities going on. It's not going to, and I laughed and I said, no, you absolutely are. Our associates felt safe to place it on our activities calendars and start to do, you know, those kind of groups that allowed, and again, being, as Sadiya mentioned earlier, you know, feeling safe. And it's like those older adults, and it's like, well, my son is gay or my daughter is a lesbian, and being able to sit with other people, you know, other residents and have a safe, you know, conversation. It was really just a cool thing to watch happen. And now we're putting, you know, activities on our calendars, not just in June. And it's starting to, you know, spread throughout the community. And it's really kind of a cool thing to watch, to see it happening. But when you walk into Hebrew Home, it's all inclusive. It's a very welcoming atmosphere for anybody that's coming in.
Brenda, do you find that different locations of Charles E. Smith kind of engage with this in different ways?
You know, our younger, because of the way our campus is set up, 3 years ago, you know, the last 2.5 years have really been COVID focused. And all of our, you know, it's like we were doing a lot of things by Zoom. I think we've all become Zoom, you know, experts now for the most part. Being able to do cross campus activities with different groups are pairing people up. Mm-hmm. You know, we have the 2 independent living residents that we have on our campus. The one, which is 250 apartments, has folks that are like 65-ish years old, and are still out in the community working. So they're very, you know, active in the community. The other independent living, and I believe the administrator is on here with us, the executive director, that age group is older. And when I say older, they have 100-year-olds living in independent living in that particular building, you know. And then you go to assisted living, and that age group even goes up higher, which is about 95 years old. I had those numbers. It's funny that you asked. And then the nursing home, it's like the average age is about 85. So the independent living and assisted living, they're doing trips out into the community. During Pride, they actually went down to there were some activities with that, with going down and participating in Pride activities. So being able to take our residents out into the community and being part of it also. So we're just not here. We're on 38 acres in the middle of Rockville, which is kind of a unique, you know, it's like a little college campus in the middle of Rockville that we sit on. So each one of the communities, they do get to participate with each other and with the community at large.
And I had a direct kind of question to me in the chat that I wanted to pose without giving any information away about the individual. But if someone was looking at the services, looking at the site, and found that there was no indication that it was inclusive, found that they weren't seeing symbols or information that they would expect to see after having gone through SAGE training and things like that, who would they speak to, or how would they convey that information to Charles E. Smith?
So I think anytime, you know, speaking with admissions, ask to speak to the administrator, ask to speak with the director of nursing, mm-hmm. ask to speak with some, you know, of the nursing assistants, mm-hmm. Or any, you know, in any of the departments. Somebody, you know, just walking down this, you know, if you're touring, hi, how are you? Tell me about your, your organization. Don't be afraid to ask associates questions. Because that's who you're going to be working with. You're not really going to see the vice president of operations very often. You're going to see those folks that you're working with on a daily basis. Stop and talk to them.
Awesome. Thank you. All right, let's move on to the next bullet point. So marketing materials. When I look at a website, when I look at brochures, when I look at paperwork, what I'm looking for are the images all of heterosexual white couples? Are there people of color? Are there images where two men are hanging out together and maybe they're fishing, right? Because some people can look at that picture and say, oh, it's two friends fishing, how great. And some people can look at that picture and say, oh, it's a couple fishing, how great, right? Are there indications that this is an inclusive space? Are there indications that individuals live here already, or that are part of my community, or that there's an openness to people from my community? Right? What's the location of the space, right? Geography is important. Are they located in a pretty conservative part of town? Are they located in an area that's known to be a little bit more open, a little bit more inclusive? What's the kind of language on the materials, right? Do I see like we have family day and, children and this and that? Do I see all of these indicators that are very kind of heterosexual in nature or heteronormative in nature? Or am I seeing like all families welcome? Or if they have a dance class, all gendered couples can, are welcome, right? Is there language that is open and friendly and inclusive? Is there language that indicates that more than one understanding of what love is depicted, right? And the other thing that I would throw out there is that LGBT older adults, right, up until 1973, heterosexuality was considered a mental disorder, right? You had the 80s, the HIV/AIDS crisis. There's been a long history of mistrust of hospitals, of doctors, and things like that. And so that's one of the reasons why LGBT individuals have higher rates of self-medication through drugs and alcohol. And there are certain health disparities in the community, because if you are afraid of accessing care, if there's a fear of accessing care, you are going to self-medicate, right? So if all of your events at the community center around alcohol, center around like wine and dine, or paint and sip, or things like that, you'll find that it doesn't feel as inclusive. So having events that are, not as centered around alcohol, having, a variety of events hitting a variety of different identities. Brenda, can you talk to us a little bit about the images and marketing material that you've worked on?
Sure. So actually Jenny is part of that, but as you saw when I had it up behind me, we've actually posted on our internal website also. So not only is it going out to, external, but internal, so that everybody recognizes the fact that we are an inclusive community. And being a Jewish community, it's like being inclusive is very important to our values, and how do we live that? So, when we look at our marketing materials, it is the SAGE logo. We are putting it on our marketing materials.
Wonderful. Next bullet. Okay, great. So one of the other things to look for when you're doing your tour is the physical space. So when you see their bathrooms in kind of public areas, if they're single stall restrooms, are they gender neutral? Because honestly, if they're single stall restrooms, there's really no reason to have a men's restroom and a women's restroom. If you're that worried about a urinal, you can say all gender restroom with a urinal, right? But there's no reason to separate them out. Ask about room assignments, right? Do you room based on gender identity, or do you room based on sex assigned at birth? Right? That's going to tell you a lot about whether this place has considered how they work with transgender individuals, right? is you're looking around, and this is something Gary mentioned earlier, what's the kind of physical things that you're looking for? You're going to be looking for posters, pictures, flags, lanyards, anything that shows that rainbow pride. And we're not looking for spaces that are trying way too hard, right? Not the unicorn glitter society of rainbow awesomeness. That's not what we're looking for, right? Because study after study conducted has found that LGBT elders don't want to live in a place that's just for LGBT people. They want to live in a diverse community where they can learn and grow with other people, but that where they feel included. So posters that have, you know, prominent LGBT figures like Laverne Cox or George Takei, right? Pictures of past events or pictures that include like Pride when you participated in Pride, right? The LGBT flag is somewhere in the space or somewhere in the poster or somewhere in the materials that you're using. You see folks walking around with rainbow lanyards, right? That's an indication that this organization has considered having some kind of champion program where someone who is, you know, very passionate about a particular thing, like in this instance, if someone is very passionate about caring for LGBT individuals, they identify themselves with a rainbow pin or a rainbow lanyard as someone that residents can come to ask more information or ask questions or register complaints about what they're going through. So looking for that rainbow or those cues in spaces around the facility. Brenda?
No, I really don't have much to add. I think, you know, when you do see rainbows, the pins on lanyards, it really does give you someone that you should feel safe being able to talk to.
I can add also, and I know I'm just the host, but I also do tours for new people coming into the community, and our activities calendar, you can always request that so people can have access to things that we are providing in the community. And that's in any one of the communities on campus.
Awesome. I believe that's the last one on the list. Could you go ahead and hit the space bar for me? Ah, yes. This is probably the most important. And it touches back to something Brenda was saying earlier, that we're all human beings, right? We all only know what we know and don't know what we don't know, right? But we enter into this work hoping to make a difference, hoping to care for people. We enter into elder care because, I mean, we have some kind of connection with it, or we want to do good. Right. So if you approach someone, maybe they don't say LGBT right. Maybe they use the wrong word. Maybe they, you know, have no idea what you're talking about. But if you're working with someone that has compassion and humility, that's open to learning, that is willing to take that extra step and say, hey, I don't know this, but I want to. At the end of the day, that's really what you're looking for. If you don't see a rainbow flag, if you don't see the right intake information, if you don't see the right marketing information, you should be able to ask for it. You should be able to have a conversation. You should be able to talk to someone and know who you can talk to and have the discussion and have them take you seriously. And if that happens, if that piece is in place, then the rest of the other pieces can fall in place too. But at the end of the day, what you're really, really searching for is being able to go up to an individual during the intake process, during the tour process, and say, hey, I don't see this. Can we talk about how to get this here? And if you're listened to, then that's where you need to be. That's what you're looking for, individuals with compassion and humility. All right, I think that's it for me. With the last few minutes we have, I'd love to open it up to questions.
Sadiya, I just want to say from, you know, Charles E. Smith Life Communities, thank you to SAGE for all you do for the LGBT community. I just, you know, it has been a tremendous program for our organization, and I know that, you know, we look forward to continuing our work with you all and helping anybody else. If you have questions, please feel free to reach out to us. We're, even after this, we're here if you have other questions or comments that you would like to ask.
So one of the questions was is there a list of SAGE trained facilities in Maryland?
So I'm putting the website in the chat, but yes, you can go to sageusa.care. And there is a section on top, a ribbon on top that says find a provider. And then you can put in any parameters you want, where you're looking at. So in the state of Maryland, if you're looking for assisted living communities, if you're looking for hospice, for nursing, whatever you're looking for, home care, you can put in any parameters you want and find SAGECare trained organizations in any state, except for North Dakota.
Which we're working on, right?
Mhm.
Sadiya, I'm going to help you with that. We're going to get them.
Thank you.
We'll get there.
I feel like if someone brought North Dakota to our team, they would do the training for free, and we would get like a pizza party or something. Yeah.
Let me see what I can do to help you there.
Okay, so if you have any questions,
Okay, please talk more about the training that is required for a SAGE representative. So the SAGECare training, thank you so much for asking. The SAGECare training takes place in two parts. There's management training and staff training. In order for an organization to be platinum credentialed, 80% of the management staff has to take a 4-hour in-person training or a 3-hour online training. And 80% of the line staff has to take a 1-hour training. And you have to re-credential every year because learning is lifelong, right? And you can't get everything you need to know in 1 year, and information changes. So every year, the line staff, 80% of the line staff has to take a different training. And we have about 12 different topics that we train on. And we're constantly adding new material and updating material. So every year, the line staff, again, goes through training to maintain their credentials. So you'll see organizations on our website that have had their credentials since we started in 2015. And every year they have to re-credential.
okay, so what I'm going to do, I'm going to start closing things up. If anyone has any additional questions, please put it in the chat while we're going through. Thank you everyone who has joined us in person and virtually. Please join us for our next Insider, which is November 16th from 12 p.m. to 1 p.m. We do also, you can find our videos on our website at Charles E. Smith Life Communities. If you have any questions, thank you. Yes, Charles E., thank you very much for posting the website. And we look forward to seeing you next week.
Thank you all.
Mm-hmm.